Hi, I'm Dr. Dan Rubin. I'm here with another episode of Ad Hoc with the Doc. I am here with my mentor, my friend, my colleague, my teacher, Dr. Lisa Altschuler. We practice both at Naturopathic Specialists. And Dr. Altschuler is an expert in survivorship for people with cancer. I'm so fascinated to talk about this subject because I get little bits and pieces when we sort of pass each other in the clinic or when we text or when we talk. But I don't know enough about this. And people out there are surviving. Mm-hmm. They're thrivers. They're survivors. What are some of the key pieces of that people out there need to hear who are surviving or who are looking to become survivors?
Well, you know, I think that cancer care is getting better, right?
It's getting better.
More people are surviving, which is awesome.
More treatments, more biologically related treatments.
Yeah, which is great. And unfortunately, at the same time, a lot of these survivors finish their treatment, they're patted on the back, you made it, go have your life, and they feel like they're looking over the abyss and they're afraid, they're symptomatic. So I think the first thing is to really acknowledge that when you become a survivor, let's just define it for a moment as somebody who's completed treatment, although really I think you're a survivor the minute you're diagnosed. You survived 1 minute of your diagnosis, but let's just say...
I think that's very valuable for people out there who may not get done with treatment.
Absolutely.
Are still considered survivors.
Absolutely.
Very important.
Yes.
Okay.
So let's say you've done with conventional treatment and it's okay to not feel great. I think there's this sort of burden that people take on that they're done with treatment, they should feel good, they should reemerge in their life, and everything should be kind of back to normal.
Yeah, but they've had all these treatments, their body's been battered and bruised and surgerized and stuff, and maybe some haven't gotten the right nutrition along the way, etc.
Yeah, so I think that the journey in some ways is just begun. Okay. But the beauty of it is that if your body has made it through conventional treatment, then your body can make it through survivorship.
Yes, it can.
Absolutely.
The body is amazing.
The body is
and
incredible.
It is persistent and biologically persistent.
Biologically persistent, that's a good word. So I love working with people who are survivors in my practice because there's a certain level of motivation that survivors have, and when they get the right recommendation for their diet, if they get the right combination of exercise recommendations, if they get the right tweaking with dietary supplements, all the things that we do as naturopathic oncologists, they start to feel tremendously better. And their new normal can be way better than their normal was before their diagnosis.
That they didn't even realize. Is the body, when they sort of finish conventional treatment, is it hungry for nutrition, hungry for the good stuff? Like, it wants to heal. I mean, it's the healing power of nature that we're talking about. It's a strict naturopathic concept, and one at Naturopathic Specialists that we absolutely adhere to. And that's essentially what you're talking about, is giving the body what it needs to heal so it can get above the old normal.
Right.
Fantastic. What role does sleep have to play in this? Because I think, in general, people don't get enough sleep. I hear that a lot, or they have sleep difficulties for maybe their life. And some of them, I think, when I ask them, how did you get cancer? Why do you think you got cancer? Sometimes they launch right into, well, I've never really been a good sleeper. So does sleep play a role in survivorship?
Yeah, it does. In fact, there's lots of statistics related to various cancers where people who don't sleep not only enough time-wise, but their quality of sleep is poor. Their overall prognosis in terms of life expectancy is reduced. So sleep is incredible, but it's also hard for people to sleep when they've gone through treatment. The fatigue that people have for, say, after radiation, that's not a fatigue you can just sleep off. That's due to mitochondrial impairment, that's due to disruption of your, what we call the stress axis, and those things have to be fixed in order to help you sleep. But that's important because you've got to sleep. 90% of your healing happens when you're sleeping. So if you're not
90% of your healing happens when you're sleeping. That's an astounding statistic. 90%. I have started using certain supplements and changed my dosing to right before bed. Vitamin C. Oral vitamin C, I'm now switching my patients to at least having one dose before bed. If it's the only dose, I suggest it. And I was like, if you take vitamin C orally during the day, it's going to ward off certain things. But at the end of the day, when we're collecting our cells, and that's when it can heal. And
it's so interesting. I'd never really thought of that, but I love that idea because it's a cofactor for neurotransmitter synthesis. So you're probably helping make more serotonin and GABA and those things we need to quiet our brains down and sleep.
Sleep. Talk about, you have a program, you have the iThrive program, you and Carolyn, and there's certain components to that. I believe environmental is one, exercise is one, nutrition is one. Talk to us a little bit about how that works both in the clinic and how patients are using the program as survivorships. I know, how do you work with people at NS in terms of survivorship?
Yeah, so I think that when people see me, like when they see you, it's really the ideal situation, right? Because they have individualized, totally personalized care.
Yes.
And
we pay attention, we sit, and we focus on 100%
them. Focused, and write up plans for each person.
And we know that when they're done with treatment, there's this whole thing that they need to do to heal to get them back to that. But anyhow, keep going.
But there's only one Dan, one Lise, one Melissa, so there's really not enough of us to go around. And I think that for people who can't get in to see naturopathic oncologists, we need other options. So that's really the impetus for creating the iThrive plan, and it's very much a behavior modification plan. So it takes strategies of diet, activity, environment, which is about cancer-causing compounds in our environment, something we call rejuvenation, which is sleep, stress management, and spirit. And it gives people very personalized day-to-day strategies to change their habits so that they can gain more health.
So keep going.
Yeah, so I was just going to say, so I love when my patients use that in addition to my personal recommendation, and
so it's not in place of.
No, not in place of, because it's as much attention as we pay to patients, we don't have time to talk to them about all the behavior modification that needs to happen in order to put our recommendations into place.
What did you base your suggestions in that program off of? Is it data?
Clinical data.
Clinical data.
Human clinical studies, absolutely.
Very interesting.
Yeah.
A great adjunct. Is there an estimation out there of how many people right now are surviving cancer?
There is, and I think the current estimation, if I'm not mistaken, is about 18 million cancer survivors in the U.S. 18
million. I can't see 18 million people. I don't even know if we can see 1 million people.
We're probably seeing 0.001% or something.
And there's people out there, so, and if you're one of them that is surviving cancer, even from minute one of diagnosis, and you've just received that, and you're talking to your family members, or if you finished treatment very recently, or if you finished treatment sort of in the past and you're still not feeling well, seeing a naturopathic physician, a board-certified naturopathic oncologist like ourselves, or if you don't have access to one in your local area, a general naturopathic physician who understands healing and the physiology, and who also may be able to consult with a naturopathic oncologist, for me is advised.
Yeah.
There's certain things that somebody who's gone through treatment requires differently than somebody who's just being treated for arthritis or autoimmunity or Lyme or something like that, even though they're all chronic diseases.
Yeah, and I think we've talked a lot about recovery from treatment, but there's a whole other element, which is how do I, as a cancer survivor, reduce my risk of having to go through that experience again, having that diagnosis again. And I think that is now a really sophisticated answer. So there's really precise tools we can apply to that question, which is what we do when we have a survivor in our office, is think really hard about what tumor they had, what their bodily terrain was, what it is, and where can we manipulate things to try to minimize their risk of recurrence.
There's good evidence about that. It's just like if there's something that was related, like a tumor that was related to copper, for instance, we might want to make sure that their multivitamin has a minimal amount or no copper or something, and it takes discrete knowledge in oncology to discern that and to understand that. So it's a great example. So, any closing remarks about survivorship to tell our audience, any out there?
I guess I would say that I think if you are a cancer survivor, I first of all want to say welcome to the club, and it's a really honorable club to be in. And I think that you've been through an experience that has given you insight into who you are in this world in a very profound way. There's nothing quite like staring at your own mortality right here in front of you. And I really think there's no way to emerge from that experience without a different sense about who it is that you want to be in this world. And so I think ultimately, I'm speaking for you, but I think ultimately what Dr. Rubin and I really want to do is to apply our healing trades so that we can make you the best person that you're destined to be in this world.
As eloquent as always, thank you so much for joining us.